Thanks, everyone, and welcome. This is Amy Schultz. I am with the M-LEEaD Center, co-lead for the Community Engagement Core, and I'm really delighted to welcome everyone. This is our fourth sort of embedded sub-webinar within the larger IHSC webinar series, and we're so delighted to be co-hosting this, the Community Engagement Core, the Integrated Health Sciences Core, and the Stakeholder Advocacy Board. Before we get started, I want to acknowledge the Anishinaabe, the Three Fires Confederacy of the Ojibwe, the Odawa, and the Potawatomi, along with their neighbors, the Seneca, the Delaware, the Shawnee, and the Wyandot nations, who cared for and lived on the land from which we are presenting today for many generations. We acknowledge and affirm the ancestral and contemporary ties of the Anishinaabe to this land, and are grateful for the opportunity afforded us to present from this location. We hope that this land acknowledgement will help us as we renew and continue our efforts to engage in environmental health research and practice to promote health equity across historically marginalized and disenfranchised groups. So welcome everyone. This mini webinar series that's kind of embedded within the context of the larger IHSC is explicitly focused on environmental racism. A definition of environmental racism is the disproportionate impact of environmental hazards on people of color. And we want to recognize that environmental justice is the movement's response to environmental racism. It is an effort to create greater equity in environmental exposures and the health impacts of those exposures. And that definitions that have emerged from the environmental justice movement of environmental justice emphasize both the fair treatment and the meaningful involvement of all people, regardless of race, color, national origin, or income, with respect to the development, implementation, and enforcement of environmental laws, regulations, and policy. And that goal can only be achieved when everyone enjoys the same degree of protection from environmental health hazards and equal access to the decision-making process to have a healthy environment in which to live and work to maintain our health. So the seminar series, the webinars that we're featuring as part of this embedded series, all feature partnerships between academic researchers and community groups who are actively engaged in promoting equity, both in the environmental exposures and in health outcomes. I'm really delighted to turn it over to our presenters for today. Professor Marie O'Neill, who is a professor in the Department of Environmental Health Sciences and Epidemiology, and her longstanding colleague, Zachary Rowe, who is the executive director of Friends of Parkside, located on the east side of Detroit. And they're going to be presenting for us today on some really exciting work that they've been doing over the past several years with the title of their presentation being Climate Hazards, Housing, and Health in Detroit. So Marie and Zachary, I'll turn it to you.
Okay, well, thank you very much, Amy. And also, I just want to on behalf of Marie and I, just want to thank you guys for the opportunity to co-present today on our work. Right. Next slide, please. Okay, so just in terms of what we hope to share with you today, we're gonna briefly talk about community-based participatory research principles, or better known as CBPR. We're going to then talk about our community academic partnership. We call it CHHH for a reason, because it's a long acronym, but we're going to talk about more about that in a few minutes. Also, we're going to talk about the motivation and environmental justice relevancy. Also, we're going to talk about the history and information of the partnership. Also, we're going to give examples of research funded by Poverty Solutions. Also, we're going to talk about our future plans. And also, we're going to do a brief reflection and discussion. Okay, next slide, please. Okay, for some of you, these principles are probably not new. I see quite a few familiar faces on the screen. So just in terms of our partnership, I mean, some of the things that we felt was important for our partnership was the following principles: equal partnership between community and academic partners or participants. Also assessing community strength and dynamics, identifying priorities as it relates to public health issues and research questions, also designing and conducting ecological intervention in our policy research, feedback and interpreting research findings, and disseminating and translating research findings into intervention and policy. So what you're going to hear throughout this presentation is how we adopted these principles to our work. Just in terms of how responsive the research question was to the community, how all the partners was equally engaged in the work. So you're going to hear those themes throughout the presentation. So I'm not going to belabor them now, but just listen out for them. And then at some point, we're going to also just point you back to those key principles as well. So just in terms of the Climate Hazards Housing and Health Partnership, we call it CHHH because it's, like I said, it's a long acronym. It was formed in 2016 through the Detroit Community Academic Research Center. We had, our goal was to really look at these two questions. The first question had to do with, how do housing characteristics affect the ability to provide health sustaining and comfortable temperature to occupancy during extreme temperatures? This was important for us, especially for Parkside, because one of the things that we wrestled with during that time is, in our community, Parkside is located in public housing. And for some reason, all the air conditioning started to disappear for some reason. And the Detroit Housing Commission, well, it wasn't the Housing Commission, but the management company sort of made the policy that they were not going to be replacing air conditioning. And I think we had one of the hottest summers on record. And one of the things that we were able to do with some of that, with some of the data that came out of this project, was to begin to share that with the Housing Commission, just in terms of how important it is to have air conditioning in units. The second question that the project answered had to do with how can community programs reduce inequity and exposure to extreme temperature and health risk. And like I said, during the course of this presentation, we're going to dive more into that. And to your right, you see the steering committee partners. You had EchoWorks, you have Friends of Parkside, you have Southwest Environmental Vision, you have Jefferson East, you have, of course, you have Michigan, and then the little tiny logo is Detroit's Working for Environmental Justice. So at this point, I'm going to turn it over to Marie to walk you through the next couple of slides.
Thank you so much, Zachary, and I'm also delighted to be here to co-present. You'll also meet one of our student colleagues, Emma, who will present a few slides later on. So I'm going to talk a little bit about the motivation for some of our work. Amy Schultz gave a really nice overview of why environmental justice and environmental racism is critical. Our partnership is really focused on climate change impacts on health, and we additionally, we focused on heat, but there are other concerns. And what we know from a large body of research is that the health burdens related to heat waves, which are becoming more frequent, intense, and of longer duration with climate change, fall unequally on communities of color, people of lower income, the elderly, children. So it's a disproportionate impact. We also know that people's ability to protect themselves from heat waves depend on a number of social determinants of health, housing quality, air conditioning access, whether people can afford power to run air conditioners or in the wintertime heaters, and then also vegetation, shade trees, and sort of the urban or suburban context can affect how protected people are from heat and other climate hazards. So one of the key motivations that I alluded to in the previous slide is just the ability to afford energy. those who attended last week's seminar with Monica Lewis-Patrick and colleagues heard them talk about water shutoffs and water is a human right. And our team, and Tony Reams, who's a professor over in the School of Environment and Sustainability, leads an urban energy justice lab, which really addresses this issue of energy as a human right and the disproportionate burden of energy on communities of color and lower income communities. So I wanted to bring that up as well as part of the key motivation that ties our work to that of other colleagues in Detroit. All right, so one of the maybe interesting features of our partnership is how we got started in the first place. And Zachary alluded to the fact that we started back in 2016, and it was really through my connection with Zachary as a member of the board of the Detroit Urban Research Center that we made the connection. And what happened was that I got a phone call back in, I believe, 2014 from an investigator at Georgia Tech who said, hey, we want to do this project where we look at how urban settings can enhance emergency preparedness during power outages in extreme weather. And they had already applied to the National Science Foundation a couple times, but they were missing the link of health and knew of our team's work in the Detroit area. So I agreed to participate with my academic colleagues, including Karina Grenland and Larissa Larson. And we were focused, this project was focused on looking at how housing characteristics influence heat and then better understand the health impacts and how people can protect themselves during concurrent heat waves and electrical blackouts. So this project was funded, and the team in Michigan realized we can't do this without community partners, even though they weren't initially part of the project. We wanted the community voice. We knew that as academics, we couldn't be knocking on doors and, the Friends of Parkside or the villages at Parkside, et cetera. We needed partnerships. And so we decided to shift the project so that we really did work in partnership, especially for the data collection components of our work. And our team actually published a paper where we talked about that whole process. And at the time, our collaboration was called Heat Waves, Housing and Health. So one of the things I wanted to mention is that, this partnership has been going on since 2015, 2016, but from my perspective as a researcher, and from Zachary and all our teammates' perspectives, you can't do this kind of work without money. So we're very grateful that we have had funding from a variety of organizations, from the Detroit URC to several local Michigan, University of Michigan enterprises, and then the National Science Foundation, which funded the original study that I talked about, and then a more recently funded study, which we'll talk about in future research. So I just wanted to, mention that part of this kind of collaboration involves getting grants from $5,000 to $2.1 million, and it's taken a lot of persistence and teamwork over the years. And this link, which I believe, I'm hoping you all can see. Can people see this, that I've just clicked on the link? Zachary, you're the only one I can see, so say yes if you can.
Yes.
Okay, excellent. So this is a website which describes our partnership. And the main thing I wanted to just highlight on this website is the team and just the range of people that we have. And of course, I won't belabor this, but we have our community partners, the 5 nonprofits that Zachary talked about, academic partners listed here. We have some new ones, Barbara Israel and Johanna Mathieu. Rebecca Nicodem was with one of our nonprofits. And then we've had a range of students from the undergraduate to the graduate level participating. Katrina Burns, Dominic Bedmar were PhD students. And so I just wanted to sort of talk about this as it's taken a village, and we've had a really wonderful set of people who have worked with us over the time of our collaborative. So I'm going back into the slide. So I just wanted to mention that as a key point. So Zachary, I believe I hand it over to you here.
Yeah, thank you. Thanks, Marie. So just sort of going back just to something Marie said earlier that's really important is that the original project, the original project that sort of brought the partnership together was not a CBPR project in no stretch of imagination. It was a traditional research project. Marie reached out, to the URC board and to other community partners because if I'm not mistaken, Marie, Todd, they also made presentations at the at one of the green something meeting. I forgot the name of that meeting, but they also made a presentation at other community meetings to look at getting other partners. And so that's why we got, other folks at the table, like, Jefferson East, who was not part of Detroit URC. And so it wasn't just recruiting partners at the Detroit URC, they also reached out to other folks. But the reason I wanted to bring that point, the reason I wanted to sort of go back to Marie's point is that one of the reasons why folks agreed to participate in the project, it was not to implement the health and heat wave project, because that was the farthest thing from my mind. I think it was the potential that based on the findings of that project, that we can sort of use that finding to create our own project in response to things that was going on in the community, right? And I say that to sort of say, that's how the Detroit Communities Reducing Energy and Water project sort of got started, or we call it DCREW for short because it's another long acronym. And so that project got some of its start from the work that we were doing with sort of the heat wave project as well. One of the things that was important for the community partner is to understand ways, first to understand sort of the energy sort of utilization in the community, but also trying to figure out ways that the community can also reduce their energy costs, right? Like Marie mentioned earlier, we received a small pilot grant from the Poverty Solution in order to do this work. The project focused on reducing barriers to assistance programs among low-income Detroit residents. There are many energy programs out there that's available for low-income folks. The issue, though, is that there are all kinds of barriers to accessing those resources. And so the DCREW project was looking at identifying those barriers and trying to find ways to better address those barriers. Also, we implemented what we called a individual case management approach, which means that our case manager, and one was housed at Friends of Parkside, would work with families around their energy needs, right? Also, we spent time on educating homeowners and residents around efficiency and conservation education and tools, and that was a sort of a big hit, believe it or not. Also, we spent time assessing if high or low indoor temperature in the summer and fall influence cognitive function and sleep quality. This was another project that was added on to the DCREW project, and we're going to go into that in the next couple of slides. And then also understanding the health benefits of energy efficiency upgrades. Next slide. So, so just in terms of how we recruited folks for the study, this was the decrew study that we're sort of talking about. So basically, participants were recruited from the village of Parkside. And for folks who are not familiar with the village of Parkside, it's a public housing complex located on Detroit's Lower East Side in the Warren County area. We're probably about a mile west of Grosse Points, if you're familiar with Grosse Points. There's about 175 residents that live in Parkside, which equates to roughly a little over 500 men, women, and children that lives there. Also, the other neighborhood that we sort of worked in was the Jefferson Chalmers area. If you look at the map, Parkside would be that sort of pinkish color, and sort of the light lime green would be the Jefferson Chalmers area, right? So interested community members community members that was interested in participating in the project, they were asked to attend a workshop, in July. The idea was to sort of get everybody in one room to be able to inform them about the project, and also to be able to do the consent all at one time instead of recruiting people individually and trying to do the consent process. We decided to sort of do it all at one time, and for the most part, I think we were really successful in sort of doing that. We had 43 community members consent to participate, and 25 out of the 41 community members consented to participate, and 25 out of the 41 participants consented to also participate in the sub project that we're going to be talking about as well. The other thing about the recruitment of the participant is that it was done there was a workshop that was done in Parkside, and there was another one done in Jefferson Chalmers, just to make it convenient for those communities to easily participate in the project. Okay, next slide. I'm not going to belabor this slide because Marie sort of already introduced you to the slide, but this is what we call the Detroit-based team. We had Michelle, who was our case manager, our sustainability case manager. We had Gabron, who worked with EcoWorks, that was going into the participant homes to help them install their energy saving kits, like the window stripping or the things that go around the window. He actually went into the homes and worked with folks to be able to sort of do that. And then you have me, and then also you had Michelle Lee from Jefferson East. So at this point, I'm going to turn it over to Emma.
Yes. Hi, everyone. So as Marie said, I'm one of the undergraduates on the project. I'm going to be talking specifically about the intervention of the pilot study. So this 1 and 2 on the left-hand side represent the different components of the study that Zachary has just mentioned. The part 1 of the study is the case manager approach to improving energy efficiency and reducing barriers to programs. And the part 2 is the cognition study and temperature study, which we're going to talk about later. So for an overview of the timeline, the initial meeting where participants consented and completed a pre-intervention survey occurred in July 2019, and we began collecting temperatures in August. At the initial meeting, participants were given a packet with suggested DIY energy efficiency upgrades and energy efficiency programs in which to enroll. The second workshop, which Zachary also talked about, was held in October, where Gibran Washington from EcoWorks, one of our community partners, presented about different DIY and cost-effective energy efficiency upgrades. The team began visiting the homes of participants in November to check temperature monitors and to have our project case manager, Michelle Alford, provide program enrollment and referral support. Gibran Washington also did an energy efficiency check and assisted participants installing energy efficiency upgrades there. We'd been planning on holding our final meeting in the spring of 2020, but this was moved to a final phone call because of the coronavirus outbreak. And during this final call, we administered the post-intervention survey, and we are now working on findings and follow-up with our participants. So for the methods, after participants consented at the initial meeting, we installed temperature monitors in their homes and recorded hourly temperatures beginning in August. During those months, participants were called 2 to 5 times. It varied, to complete cognitive function tests. In one test, participants were presented with a list of words and had to recall them both immediately and again at the end of the call. And the Epworth sleepiness scale is just to see how tired participants may be in different circumstances. So here we have demographics from our initial participants who filled out the pre-intervention survey at the first meeting in July 2019. There were 40 participants, almost half and half from both Parkside and Jefferson East. The majority of participants are Black and female with an income of less than $20,000 a year. About half own their homes and half are renting. For the next slide, for the post-intervention survey, we lost 9 participants, but demographics were still consistent with the pre-intervention survey. So for the next couple of slides, we're going to highlight some of the post-intervention survey question responses. But first, for an overview of what our intervention groups looked like, we classified our control group as those participants who attended only the July kickoff meeting. Our intervention A group are those participants who attended the kickoff meeting and the October workshop from EcoWorks. And finally, our intervention B group attended the kickoff meeting, the October workshop, and had a home visit by the research team. This first question at the bottom asked if participants found the packet from the first July meeting beneficial in terms of helping them enroll in programs or make any upgrades. And the majority of participants answered that it was beneficial or extremely beneficial. This next question asked if participants made any upgrades following the EcoWorks October workshop, and it was about half that did and less than half that enrolled in programs following the presentation. For the next slide. So when asked if the October workshop was beneficial, more than half classified it as beneficial or extremely beneficial, and 94% said that they felt it would benefit others. For participants in intervention group B, when asked if they made any upgrades following the home visits with the case manager and Gibran Washington, more than half said yes, and 100% said that this support was either beneficial or extremely beneficial, and 100% said that they felt this support would benefit others. And this slide just shows a visual representation of responses to a couple of the final questions of the post-intervention survey. Most participants did make changes to how they use energy in their home after their participation in the project, and most said that they felt their energy bill went down as a result. So overall, looking back, participants said that they felt supported by their case manager and felt that their participation in the project was beneficial. So I think I'm gonna pass it on to Maria.
Sorry, I realized I'm muted, but I want to thank Emma. It's been wonderful to have her. She will graduate this year. We have another wonderful undergrad, Donna, who is has worked with Zachary and has also contributed to these slides. So we really appreciate the contributions of the students, including Emma and Donna. So I'm going to just briefly talk about the research on cognition and sleepiness, which was really led by Karina Grenland, who was a member of our team. That was, as Zachary indicated, kind of an add-on where we got the funding from Poverty Solutions to do this intervention study. And then we realized, you know, it might be interesting to look at some specific health and well-being measures in the hopes that our partnership can you know, continue to do work in this area and looking at health benefits of energy security and things of that nature. So as Emma mentioned, we had 25 participants who agreed to participate. We had a wonderful team of students who actually made phone calls to these participants, and we were concurrently measuring temperatures in their home by means of a little monitor that was placed on the wall. And so we were able to download those temperature data points during our home visits. We could collect the monitor or download the data from the monitor and then link them to the information participants provided on their sleepiness as well as their cognitive function, which was measured through word list recall and other things like that. And we are currently preparing a co-authored publication. We're going to include our community partners as co-authors, which is a CBPR approach, because clarity and the relevance of the results, and even just the methods from the beginning were definitely developed in partnership. So it was a small study, but the data that we collected serve as pilot data for some grants that our colleague Dr. Karina Grunland has submitted, again with our community partners as participants. And the hope is that we'll be able to look at health benefits of weatherization in low and middle income communities in Detroit, as well as other places in the United States with a higher sample size, look at some of these similar kinds of questions of these health outcomes and understand temperature, but also apply results for improvement of conditions for our colleagues in the residences that we'll study and others. Okay, so I think that we're reaching the final point of our presentation where we'll talk about the future research. And as I mentioned, we've had a range of grants from very small to large, and most recently, the National Science Foundation has awarded over $2 million to our team, our CHHH team, led by Tony Reams. And in addition to the partners that we have mentioned before, we have some colleagues, new colleagues, Barbara Israel, Chris Coombe in public health, Joanna Mathieu in engineering, and Karina from the Institute for Social Research, who are participating in this NSF study. And unlike the first study, the idea was to make it a CBPR project from the very beginning. It is a project funded under a relatively new mechanism called Smart and Connected Communities. And that NSF mechanism is really intended to connect academic researchers with communities and think about how technology can improve health and well-being. So this has been funded. We have subcontracts to our nonprofit participants with associated indirect costs and all of those good things that are ideal to have when you're doing community-based participatory research. So we were just funded, and the main research questions for this new project include following up on what we did in the DCREW project and really evaluating how a neighborhood embedded energy case management person, who in our DCREW pilot was Michelle Alford, could help residents reduce their household energy insecurity, again, with some of the same measures we piloted in DCREW, but with a larger sample size. A second research question for our new NSF project is, how can we bring together the issue of energy or electricity as a basic human right from low and middle income households? You know, how can we use technology to help determine what would be the baseline amount of energy to provide for the needs of residents in these communities? And then the third question is thinking more about how we integrate some of our findings into electricity rate structures. And some of this work is the expertise of Joanna Mathieu in engineering, who has done quite a lot of work on energy supply demand. So that's our new NSF project. And this next slide just gives you a sense of how we're approaching addressing these research questions. The energy case management is very similar to what we've talked about with DCREW, and I think the ability for us to show this as a feasible community partnership and effort through the DCREW was fundamental to our success in in getting the funding from NSF, and then we're moving on to add some of these technology components. So this, we're excited. We're in the process of planning right now. And especially Dr. Reams has been talking with Zachary and our other community partners to really integrate our work into the needs and daily reality of those who are participating, and to ensure that the results can inform policy relevant to community concerns. So my next slide, I just wanted to give one last shout out to the current students. You saw on our website that we've had a number of students involved. Quentin is our public health master's student who's working with the DCRU data, and Kancham has been also helping us with the data management. So that's been a really nice feature in addition to the community partner collaborations, is to have students engaged in our work. So I just want to acknowledge again the participants, the residents of Parkside and Jefferson East, and we've also had some in Southwest Detroit for our other NSF project. Their participation has been essential. We've shared meals with them pre-pandemic, and we really appreciate all of that, as well as the funding that I talked about at the beginning. And I think at this point, I am done, unless I'll maybe ask Zachary if you want to make any concluding remarks, but I think the lessons learned have been it takes a village, and we've done a lot of really interesting work and are looking forward to continuing our collaboration in the future.
Mm-hmm. You did a great job. You did a great job, Marie. So I'm just ready to open up for questions.
Great. Thank you to Marie and Zachary and Emma for a fabulous presentation. You covered a lot of ground over multiple years and multiple grants, and it's exciting to see this work progress and the way it's progressed over time. We do have a few minutes for questions, comments from those of you who are participating. Feel free to raise your hand. I think Meredith and Allison are going to be helping to monitor hands raised. And also, if you prefer, go ahead and just type a question into the chat, and we can have a little conversation with our presenting team. Give folks a moment to
Toby has
thoughts.
Toby Lewis has a hand raised.
Okay, Toby, go ahead.
Hey there, that was a great presentation. Thanks so much. Really exciting work. So one question I had is, in the beginning, you framed things in terms of heat concerns, but when I think about electricity insecurity, I think it's heating concerns in the winter that often are in the forefront of residents' minds. And I'm just curious about whether the community members emphasized one season more than another in terms of being in the front of their minds, in terms of what their concern was, and sort of how that dovetails with what the funders were interested in.
Want to take that, Zachary?
Well, I mean, I was thinking about Toby's question, the best way to respond to Toby's question. So the initial focus on heat was because of the initial grant that Marie received and brought to the community. And so I think that's really got us to sort of thinking about, well, yeah, I mean, heat is an issue, but we never really thought about what we could do about it initially. And that became apparent when we were sort of having various committee discussions about heat and heat exhaustion and that kind of thing, realizing that, in the community, we really don't talk about heat exhaustion or anything like that. We sort of just say we're hot or we're tired. I mean, there was some terminology that we didn't really think about and we didn't really use to describe how we were feeling. And so I'm sorry. So Toby, can you repeat your question? I want to make sure I hit all those points because I think there are a couple of things.
So I mean, so for everyone else, Zachary and I have worked together for many years on asthma issues. And, you know, when in talking to community members, like I heard a lot about cold and being cold in the winter and what happens when your electricity gets shut off and how do you stay warm in the winter. And people talked about hot, you know, feeling hot, right, just like you described. Right. But again, that was also my sense was people just accepted that to a certain degree, yes, as something that couldn't be intervened upon.
Exactly.
Right. So and when you're talking about energy security and since a lot of people don't have air conditioning, when they're thinking about electricity security, they're thinking about keeping the heat on. Mm-hmm. You know, in the winter time, and just trying to understand a little better about how those where the priorities are with the community and how as a partnership you sort of navigated, okay, the funders have this priority, the community may have that priority. We don't mind the funders' priority, but like, how do we bring these all together?
Yeah, excellent question. And so just sort of continue my train of thought earlier. So Parkside is sort of a unique community compared to maybe Jefferson East and other community, because initially all the residents in the village of Parkside had central air. So it wasn't like they didn't have air conditioning. So they wasn't sort of necessarily used to that extreme heat experience, especially in the home, because they could cut on the air conditioning. It's only when those air conditioning got stolen during the summer. I think 90% of the air conditioning got stolen in one summer that really made heat an issue for the community, which compounded the problem is the management policy around only replacing air conditioning if residents received a note from their doctor saying that they needed air conditioning because of their health. So initially the heat really wasn't an issue because, you know, I mean, even though it was outside, that was okay because you can go inside and cut your air on. But when your air conditioning, you know, got stolen, now you had to experience the heat indoor and outdoor. You couldn't really get away from it. And so that, you know, and just sort of, and that's, you know, one of the things that we also did with, you know, with the original project is that we shared with folks, you know, we gave them tips, things that they could do to help, you know, sort of, you know, mitigate, you know, the heat concerns, you know, during those extreme heat days. Like, you know, of course you could, you know, you can go over neighbors. Sometimes you don't even think about, you know, some simple tips you don't even think about, like maybe going over neighbors. Maybe if you got a car with air conditioning, maybe go outside and sit in the air conditioning for a while. Maybe we try to give people practical tips for addressing sort of the heat issue. And then from a larger system perspective, you know, we try to sort of nudge and push the Housing Commission to institute a policy whereby, you know, air conditioning was, you know, a requirement or was a necessity, just like having a refrigerator and stove. We're still working on that, but, you know, we'll see. And so I think that's probably was one of those times where the funder priority sort of met a community need, right? You know, because like, so we really wasn't thinking about heat at that point, but then it became a issue for the community, you know, after the air conditioning was stolen. So hopefully I answered your question.
Yeah. And it looks like Marie would like to weigh in. Yeah.
Yeah. So thanks, Zachary and Toby. I also want to give a shout out to our colleague, Pete Larson, who is on our call today, because I think I neglected to mention his major contributions in our project. So thanks, Pete. But after that, I want to say, yeah, you know, Toby, I think it's really interesting that a lot of the research on climate change and health does focus on heat, even though we know that the variability in temperature is changing and extreme cold snaps and, you know, just a range of temperatures are really relevant to heat, to people's health. And some of the things that Gibran Washington guided our residents to do, weatherization, improving insulation, those things are also energy saving during the winter time. And Tony Reams is actually, you know, with Karina and others, we're interested in looking at both cold and heat as they affect people's health and how improving energy and efficiency and weatherization can mitigate some of those health impacts. So I think your question is, you know, really well taken. And, you know, heat waves are part of climate change, but so is more extreme cold. And I think, you know, the concerns about residents in Detroit, we renamed ourselves climate hazards in part because of those extremes, and also because the residents in Jefferson East in particular, which are right by the water, experience flooding, terrible flooding when there are extreme rainstorms, for example, which are also increasing with climate change. So I think your point is really well taken. And, you know, I think that's part of why we want to move forward, not just being limited to heat as our main concern. And like Zachary said, you know, it is a concern, but so are other things that are addressed by housing improvement and environmental justice.
Thank you, Marie. Oh, sorry. Did you want to finish? I didn't mean to interrupt.
No, I'm done.
Okay.
I'm done.
We have a couple more questions in the chat and just want to make sure that we get to those. So from Trish, congratulations on the new grant. The pandemic likely caused many changes for Parkside residents. How have things changed between when the grant was submitted and now? And linked to that, how will your approach likely evolve?
That's a great question. And I'm gonna think that must be directed towards me because it said Parkside, right? Okay. So yeah, so the pandemic really caused the organization and the community to sort of pivot. I think it also opened up some interesting opportunities for us. The whole idea around technology. I think you hear folks talk about the digital divide and lack of technology, those kind of things. And so those things are real. Even in Parkside, they are real. And because of the pandemic, it really sort of brought that front and center. And as a result of the pandemic, that really caused Friends of Parkside to really begin to work with Comcast and AT&T to look at providing residents with internet. Comcast has this great program called Internet Essential, whereby homeowners can get internet for $9.95 a month, right? Which is probably affordable for the most part. And so I'm sort of saying that to say that with this project, one of the things that it's going to allow us to do is look at how we can sort of start to create smart homes, making Parkside like smart homes. The first thing is looking at those smart meters so that residents can sort of keep track of their indoor temperature using their smartphone or their tablet or whatever. Then also looking at introducing other smart devices into the home that's going to really help residents with energy efficiency, safety, those kinds of things. So in some ways, this pandemic, it created other opportunities for us that we would not have explored earlier on.
Thank you, Zachary. We're just about out of time. I want to thank Karina, who weighed in with a comment in the chat on the previous question, indicating that inefficient use of energy, including energy for heating in the winter, contributes to climate change. So we can also tackle climate change mitigation issues through some of the programs that Zachary and Marie are talking about, in addition to adaptation. I'm going to take our last couple of seconds before we have to close and just give a shout out to our upcoming events in the webinar series. Thank you, Meredith, for popping these into the chat. So our next webinar is April 13th, Environmental Racism and Environmental